When you hear LSD, you might think of the 60s and Timothy Leary who urged people to turn on, tune in, and drop out. Back then, it was counterculture. Today, though, science is looking at LSD in a new way as a potential treatment for anxiety.
Yeah, to help us understand what this means for patients, we are joined by Dr. Brian Barnett, director of the Cleveland Clinic Psychiatric Treatment Resistance Program. Dr. Barnett, first of all, thank you for joining us. Let's start with what this study published in the Journal of the American Medical Association actually shows. Can you take us through it?
Sure. Yeah. Thank you all for having me this morning. So the study was looking at a proprietary version of LSD and its effectiveness for generalized anxiety disorder. So participants in the study received a single dose of LSD, but it was what was called a dose finding study. So they could either get a placebo or 4 different doses of LSD with the intention to find the dose that balanced efficacy and safety the best.
How did this start as an idea, going from a psychedelic to a treatment option?
Yeah. I realize for some viewers this might sound pretty new, but there's actually been a lot of research going on in this area for about 25 years now in psychiatry. A lot of it has been with psilocybin, which is the psychoactive compound in magic mushrooms. But there are a variety of companies now that are looking at different psychedelics for different psychiatric and substance use disorder indications. And so this particular company reviewed the literature, and they saw that in the 1960s and 1970s, there were a number of studies done with LSD, often in patients with serious medical illness such as cancer, to treat the psychological distress associated with that. And so there was a signal there for treating anxiety. And so the company decided to look at generalized anxiety disorder as the particular indication.
This is fascinating. It really is. This study shows a single dose, one dose, can reduce anxiety for months. First of all, is this true? One dose, and then secondly, what kind of side effects are we talking about with this?
Yeah, so the study found that the optimal dose was 100 micrograms, and the participants who got that single dose 12 weeks later, half of them were in remission from the generalized anxiety disorder. So that means they either had no anxiety symptoms at all, or they just had a few that didn't rise to the level of meeting that diagnosis. So it's a very exciting finding. We have really not had anything in psychiatry that works that way for anxiety. Typically, people are either going to therapy continually or they're taking a medication every day. Now, in terms of the side effects, there weren't really any that were unexpected. We know that psychedelics strongly alter consciousness, so people have what we call illusions or visual hallucinations. LSD can increase heart rate, blood pressure. Very rarely it can make people anxious during the experience, but the study sites have medications on hand if that were to happen, and that was not a problem in this particular study. So the side effect profile was not really surprising in any way, and it was well tolerated.
How similar are these? You mentioned psilocybin. How similar are these findings to what you have seen with psilocybin, and what are the biggest regulatory legal hurdles before this actually becomes an option?
Yeah, that's a good question. So psilocybin has not been looked at for anxiety in particular, but there have been studies with depression, and the magnitude of the effects there have been pretty similar to what we see with the LSD for generalized anxiety disorder. So the drugs do work in a similar manner. They do have some differences. LSD lasts longer than psilocybin, but it does seem to be in line with the results that have been found for psilocybin. Now, on the regulatory side, working with these drugs is quite complicated. So we've done a number of these trials. There's a lot of sign-offs that you need from the FDA, the DEA. It can take a long time to set up one of these sites. And so that's been one of the challenges in this work is it takes a really long time just to even get started. But with that said, there are a number of companies now that are working with the FDA to try to get these drugs approved by the FDA. And if we continue to see positive results, we could see the first one of these drugs approved within the next 2 years.
Now, are there any restrictions for driving, or how about work performance on LSD? I mean, is there any sort of impairment?
Yeah, that's a great question. So all of these patients were treated in a healthcare center. So they had one or two monitors with them during the study the entire time. So nobody went home with LSD. They had to be on site for 12 hours until the effects fully wore off, and then they could go home afterwards. So they couldn't drive. Somebody had to come pick them up. So with these drugs, there are certainly a lot of safety precautions, and if we do see them eventually approved by the FDA, I think they would only be administered in a healthcare facility. I don't see a future where people are getting these at home.
Right. Yeah, that makes sense.
In these doses that you're talking about, are people actually having hallucinations? Are they tripping, or do they not feel that level of impact?
Yeah, they are. So the optimal dose here was 100 micrograms, which is essentially what people would buy on the street if they were taking LSD. So that's the dose where people can have pretty significant illusions, hallucinations, sometimes what we call mystical experiences, where they feel like they're at one with the universe or God. So it can be some pretty transcendent, profound experiences for people. The lower doses were tested, doses on the order of what a lot of people describe as microdosing, but those were not found to separate from placebo.
I've been reading a lot about the effect of ayahuasca on mental health. It's really interesting to see some of these drugs and the impact. And it's very hopeful, isn't it, for people who really suffer with anxiety or in some cases depression, and to see something that could actually move the needle.
Yeah, it is. We have a lot of patients that we're able to help in psychiatry, but for most conditions, there's around a third of patients who don't respond to the medications that we currently have. So we are doing everything we can as a field right now to explore different options and see what else we can offer people in the midst of the mental health crisis that's going on. So it's a very exciting time for the field and patients.
Yeah, Dr. Barnett, we really appreciate your insight today. Thank you. Have a great day.
From the Cleveland Clinic.